So this is the specimen showing development of the lower part of the hindgut, the lowest part. So this green thing here, what you see is the hindgut. The lowest part of the hindgut is called as cloaca. This cloaca further gets divided by a urorectal septum, which comes in between a urorectal septum here. And this is kind of dividing the cloaca. It has not yet fully divided. It divides the cloaca into posterior part, which is called as a rectum, and anterior part, which is called as primitive urogenital sinus. So what is this? What is this? This is rectum. What is this? Cloaca. It was there throughout. It is divided by this septum. What is the name of the septum? Urorectal septum. So what is the posterior part? Rectum. What is the anterior part? Primitive urogenital sinus. This primitive urogenital sinus is divided into two parts as per attachment of the mesonephric duct. So this is the mesonephric duct. The below the mesonephric duct is definitive urogenital sinus. So this is definitive urogenital sinus, from which the urethra develops. And above that is vesicourethral canal, from which the trigonal, from which the epithelium of the bladder, except for the trigone, develops. So this is called as vesicourethral canal. This vesicourethral canal is connected to the umbilicus by urachus. This urachus will eventually obliterate to form median umbilical ligament. So here you can see the umbilicus. In the umbilicus here currently you can see one vein, you can see an artery, other artery will be on the other side. This artery which is left is left, the right deceptor. So this is the left umbilical vein, this is one artery, other artery should be on the other side. And this green thing what you are seeing is the urachus. This is the urachus. So urachus is connected to the vesicourethral canal. So therefore, when the formation of the bladder which takes from the vesicourethral canal, this urachus, if it does not obliterate, the bladder will have a connection with the umbilicus, of fistula coming out, a sinus rather. So whenever a person empties the bladder, urine will come out from the umbilicus also, dribbling. Okay, so this is like an open connection between bladder and, yeah, you can call it a sinus, you can call it a fistula also, because it is kind of, bladder is opening through the urethra outside and through umbilicus also outside. Okay, now here if you look here, this is the neural tube remnant, okay, which is forming the terminal part of the spinal cord, and these are the somites. So you can see the somites, these are the lower part of the somites which are going to form the coccyx. And as we come up over here, these are the somites which are, they will surround the developing neural tube, and they will mainly form the vertebral body and the vertebra over here. So this part of the somites, they divide into three parts: sclerotum, dermatom and myotum. So this is the sclerotum component. And also you see in this specimen the lower limb bud. This is the lower limb bud, from which the lower limb is going to develop. Thank you.